to my channel. If you are new to the channel, I am Ivy Akum, and to my old subscribers, thank you all so much for always coming back. So I decided to do this video because I know that there are a lot of moms out there, a lot of new moms out there who usually get confused with these things. But when I was pregnant for my first baby, I tried to find out some of these videos on YouTube to watch so I could have like a guide or something. And what I'm going to be talking about is the things that you need in your emergency bag for the baby, especially like your maternity emergency bag, like the bag that you are going to be taking to the hospital, like maybe when you get into labor or when you're about to give birth. That's the bag that the nurses are going to demand, or the things that they are going to demand from you. Most often when you type like what's in my emergency bag or the things needed in my emergency bag, usually the videos that are going to pop up are videos maybe from Nigerians, from people in other countries. Meanwhile, the things are not really the same. They are actually similar things, but not everything is going to be the same. So I decided to do this video because it could be of help to somebody. Anita. So I decided to do this video because it could be of help to a new mom out there. So usually what happens here in Cameroon is almost every hospital has what they demand, and the things are usually almost the same. It may just change in some hospitals, maybe a little details or something, but it's usually the same. So I'm just going to be reading a list of what was asked of me from the hospital where I was doing my antenatal. So for the baby's emergency bag, what they asked was 1, the baby set, 2, olive oil, 3, spirit, 4, cotton. Then they asked for 4 napkins, diapers, innerwears, baby blanket, and bed sheets. So I'm just going to be showing you what I have actually packed in the baby's emergency bag. So the first thing, and which is one of the most important, is the baby set. And this baby set is the first pair of clothing that your baby is going to be wearing, or the nurses are going to wear the baby this set immediately he or she comes out of the womb. So usually this set usually comes like this, and then you have to check in for what is lacking and fill it. So this set came with a pullover, a trouser, I think a wrapper, a cap, maybe gloves, and then I had to add an extra cap, an extra trouser, an extra innerwear, a bib, pants. I think that's it for the baby's dresses. So it's always good to pack them in one thing like this, so you shouldn't be scattered, and the nurses are going to know exactly how to organize it. Here I have my diapers. I just put 2. Normally they're going to wear 1 diaper for the baby, but I just put 2 diapers. And then there's a suction pump. The suction pump was not written on this list, but I remember that when I was having my first baby, they asked for this, and I decided to put this in the bag just in case. I think this pump, from what I'm told, is used to pump out, I don't know, from the nose. I don't know if it's I don't know if it's from the nose, from the end nose, but there's something they actually pump, or I don't know if it's general, but sometimes they say the baby may come out and there may be a need for this pump to pump out with excess water or whatever. So that's why I put the suction pump. The next thing is cotton and spirits, and I think this will be used to clean some parts of the baby's body immediately the baby comes out of the womb. And then a very important aspect is olive oil. I think this is what they use to clean the baby when the baby comes out of the womb. It's olive oil that is used to clean the baby and actually oil the baby's whole skin with. And then we have napkins. They asked me for 4 pairs of napkins. I don't know why, but I just put it because I have to obey the rules. But I think they were asking for 4 napkins because they thought we are going to be using napkins in the hospital. But a lot of moms no longer use napkins because it's so stressful, to wash and everything. So everybody prefers using diapers. So I put the napkins because they asked for it. But I'm also told that napkins is what they use to actually catch the baby, or to carry the baby immediately the baby comes out of the womb. And I have the baby's bed sheets. So this is everything needed in the baby's emergency bag, like for the baby, because there's also the mother's emergency bag which I've already packed, but I can't start dismantling everything here. I'm just going to read over what is needed in the mother's emergency bag. So there's something I actually forgot to show you, or which I actually included in the emergency bag, which was not as though. It's a thermometer. Usually some hospitals ask for thermometers, but I think they didn't ask here because they're probably going to use theirs. Immediately the baby comes out of the womb, they usually test the baby's temperature to see if it's slightly high or it's normal. So for the mother's emergency bag, that is the bag which you are going to carry to the labor room. First, you have Demobacter. Demobacter is a kind of, I don't know if it's sterilized water or a disinfectant kind of thing, which is used there in the labor room. You have 2 wrappers, you have your nightwear, you have sterile gloves and examination gloves. All these gloves are going to be using to check how far you are going into your labor. You have lacra, which is also a disinfectant. You have 1 savon, you have 1 toilet roll, you have sachets of omo, and you have sanitary pads. That's exactly what is needed from you in your emergency bag. But these things I've listed here, this is not just all you're going to be taking to the hospital. These are things you are going to be using on the same day you actually have the baby. But during your stay in the hospital, depending on how long, you will now have to reason out what you'll be needing in the hospital. You will now have to reason out what you are going to be adding to your box and everything. But these things are actually read are just for the emergency day, like the day you're giving birth, for both you and your baby. So that's it for this video. I hope it helps 1 or 2 moms out there. Thank you all so much for watching, and see you all in my next video.